Hey everybody, how you doing? It's Dr. Jeff Wise from the Wise Institute for Hair Restoration. We love doing FUE procedures. We love doing hair transplants in our practice. It makes up a significant part of what I do. A lot of people ask me, they say, well, does it really matter? We talk oftentimes about, the FUE technique versus the strip. FUE in this day and age, which is to say follicular unit extraction, where there's no horizontal incision in the back of the head, we actually take the hairs out individually. It varies among different institutions. And I will tell you that the size of the punch is really, really important. So people say, well, what does it matter? I mean, we're dealing with such tiny numbers. So I can tell you that at some of the other institutions around, one of the conventional sizes for an FUE punch is a diameter of 1.2 millimeters. And everyone knows that 1.2 millimeters is really, really small. The punch that we use in our practice routinely is either a 0.5 millimeter punch or a 0.6 millimeter punch. And that size punch, to put it in perspective for you, is the approximate diameter, I have a visual aid right here, of a 25 gauge needle. So I don't know if you can even see that, but it's really, really tiny. So I guess the real question is, well, so who cares, right? I mean, if you're dealing with a 0.6 millimeter punch versus a 1.2 millimeter punch, why does the smaller size matter? The smaller size matters because most FUE cases, let's say a typical FUE case in our hands is, let's say, approximately 3,000 grafts, right? If you take 3,000 grafts with a 1.2 millimeter punch versus 3,000 grafts with the punch that we use, which is 0.6 millimeters, you're looking at a surface area of scarring, potential scarring, that's 1/4 of the competitor. So we're talking about I'm kind of getting a little mathy and nerdy, but half the diameter of a punch translates to 1/4 of the potential trauma to the given donor area. So it makes a huge difference. So what does that mean? It means that patients generally have absolutely no visualization of the FUE scars. They're microscopic. They close up immediately, and within a few days, people generally don't even see them. It also means that when we take our grafts, we take exactly the grafts that we need to take, and there's no collateral damage because the punch size is so small and we're so precise with our harvesting that none of the other hairs on the back of the head are damaged or destroyed. Because let's face it, we may need them at a later date for more procedures. And secondly, we just, generally speaking, don't want to damage hairs that we don't use because we want the back to look full and unoperated on. So in summary, the size of the punch matters. I don't even like to consider our procedure an FUE procedure or follicular unit extraction. I really consider it maybe a micro FUE because the punch size is so incredibly small while still yielding incredible results. So that's kind of my perspective on why size matters in an FUE procedure. Just to give people a visual representation of what a double the diameter means, this is a much enlarged example, of course, of the punch size. So you can see that our punch here at our facility is usually about 0.6 millimeters. And as I said, the industry standard out there right now varies among individuals, but could go up to about 1.2 millimeters. So that just to give you like some perspective that, once again, if you multiply this by 3,000 grafts, I mean, this is a significant difference in surface area, potentially traumatized to the back of the head. So we really, really think it's important to have a really, really small punch size. The smaller the punch size, the less damage to the scalp, and the more precise that we can be with our FUE treatments.